Good morning and afternoon to everyone. I hope most of us have joined the session, so let's formally begin it. Very warm welcome to all of you, those who are joining us today for this exclusive MRCOG-1 free webinar organized by MedExam Expert. I'm Fatma, Course Manager for Part 1 and Part 2 MRCOG. Today's webinar is a very special one. It is focused on one of the most important topics for Part 1 syllabus, which is epidemiology. And along with that, we will also be discuss how you can manage the last 3 months of preparation for January 26 intake. We are honored to have with us Dr. Desiree, who is not only a part of our senior faculty, but also an excellent mentor who have been mentoring hundreds of successful candidates throughout the globe. So without any further delay, let me just introduce Dr. Desiree. Over to you, Dr. Desiree. Please, you
Hello,
can.
thank you, Fatma. Can you hear me? Is my
Yes.
voice audible? Okay.
Yes.
Hello, everyone. Thank you for joining us in this webinar. Let me just share my screen. Okay, can you see my screen now, guys? Hello, Dr. Suhaila. Okay, we will start off with the best strategy to prepare for MRCOG, which is our subtopic for today. Okay, and then we will talk about a little bit about the progressive course that we are offering, and then we will discuss about epidemiology. So now is like the exam will be in January. You all know that. So you are here with us, whether to update your knowledge on epidemiology, but most of you will be for sure decided to take the exam. Okay, have everyone done their eligibility and the interest application for interest? Everyone has no problem with eligibility, okay? So your expression of interest, I think, will be opening soon. Okay, so what is the best strategy to prepare for MRCOG Part 1 exam with the remaining 3 months? So I know most of you are having these questions in mind. Will I be able to pass the exam even if I only have 3 months to prepare? So guys, can you please turn off your microphones? Okay, so because it will affect the recording. Okay, so believe me when I say that 3 months is just enough preparation to pass the MRCOG Part 1 exam, but provided that you strictly follow the schedule that you have prepared. Okay, I know the syllabus of MRCOG Part 1 exam is very, very vast, and we are all practicing clinicians, so probably the basics we have already forgotten. Okay, so what is the best strategy for the exam? Again, I'm Dr. Desiree. Okay. If you are serious about taking the exam this January, so stop dreaming and start doing. The best challenge is to maintain motivation and momentum over this period. So there should be no procrastinating, okay? Think about of the possible disruptions like work and family commitments and plan accordingly. When I say possible disruptions, you all know that the Christmas holiday is coming, okay? And you know, Christmas for the non-Muslims, for our non-Muslim friends out there, is a celebration or a festive season that they have very, very hard in avoiding. Okay, it is very, very hard to avoid because this is where families gather. Okay, so if you know that you will be having this Christmas holiday like expanding from 25th of December until January 1. So you have to double your effort before the holidays come. Okay, so these are the challenges. You think of possible disruptions like work and family commitments and plan accordingly. Okay, and we can do this planning in 5 steps. First, step 1, you have to take a diagnostic test or topic test or mock test. So this diagnostic test is available in a lot of platforms. Okay, for example, the PAS MRCOG, the STRAT-OG. So you can do the mock test. And MedExam Expert, our company, is also giving a mock test and topic test. Sometimes we give it for free just to test or assess your knowledge. So why is this important? Because this will help you become familiar with the test format and timing. Okay, and research shows that being tested on the materials not only measures your performance, but actually helps you learn. Okay, step 2, set your study schedule. So you have here 3 months, right? So you have to make your study schedule in those 3 months. And I know it's very, very hard for you doing it alone. But if you join us in our progressive course, we do this for you. We do the step 1, all the steps. We provide this for you. Okay. So step 2, set your study schedule in the remaining 3 months: October, November, December, and January. Okay. Because if you don't set up your schedule, there will be a danger of procrastinating. Like you will feel that there's still too many days ahead of you, okay? And you know that it's very, very hard to carve out the time for studying. But if you see this study schedule, you know that you have limited time. So you really have to study every day of those 3 months. Because sometimes you will have the tendency to feel that there are more important things needed to be done. If there are important things, for example, tomorrow you are on duty, so you have to double your effort today, right? Okay. You have to set a reasonable pace so as not to burn yourself out. So remember, studying every day, like broken times, for example, 3 times a day, you commit 1.5 hours 3 times a day, okay? Is better than committing 2 days straight. For example, Monday to Friday, you're not studying and you will promise yourself, okay, I will commit Saturday and Sunday for studying. So this will be very, very difficult because you don't know if something came up on Saturday and Sunday. Okay, so don't commit something that is not yet coming. So it's better to study every day in little segments, 1.5 hours. For example, today, it's Friday, so you can commit 1.5 hours today, this afternoon, and then in the evening, read another 1.5 hours. Okay, so studying most days of the week will improve your score compared to studying 1 or 2 days straight in a week. Step 3, develop your study plan. So how do you already made your schedule? So how will you study? Where will you start? Okay, so what subject you will handle first? So you don't know. So an effective approach is first use a resource to learn some strategies. When I say resource, this could be an SBA book. This could be an online platform that giving for you to study online, like your PAS MRCOG, okay, your BMG online, okay, and or some companies that that gives a study session, okay. These are called resource, okay, to learn some strategies or content and then follow up by practicing what you just have learned with test like question. For example, you are enrolled in MedExam Expert. We give you theories. So after these theories, you have to support it with SBA questions so that it sticks with you. Okay, applying what you learn right away will solidify your knowledge so it sticks with you. So what you should study, the next question. This depends on the result of your practice test. So you have to know your weak points. So you have to focus on your areas of difficulty. For example, you are very, very good in anatomy, but you are very bad in biostatistics. So you have to focus on biostatistics. You are very good in physiology, but you are very bad in microbiology. So you have to focus on microbiology. So that's one thing. And the other thing is you focus on the areas that is most often tested. For example, anatomy. You are all good For example, you are very good in anatomy, but some of the anatomy questions doesn't come out in the exam. So you have to know which one does come out in the exam, and you focus on that. And those who doesn't come out in the exam, or probably will come in the exam very rare, so you have to just read it, okay? So there are things that must know, and there are things that is needed to know. For example, in genetic disorders, this is one good example. So you have to know the pattern of inheritance of all the diseases, because this always comes out in the exam. For example, Marfan syndrome. Is it autosomal dominant or is it autosomal recessive? Cystic fibrosis. Is it autosomal dominant or is it autosomal recessive? So these are the patterns of inheritance and defective genes you have to know versus the location of the gene mutation. For example, cystic fibrosis. They always ask in the exam the pattern of inheritance of cystic fibrosis and the gene that is affected, which is your CFTR gene. They will not ask what is the chromosome affected. For example, in cystic fibrosis, the chromosome affected is your chromosome 7, Q arm, locus 31. They will never ask that in the exam. So don't waste your time on memorizing all the chromosome that is affected in all of the genetic disorder. For example, BRCA, your BRCA1 and BRCA2. So your breast ovarian cancer susceptibility, it is an autosomal dominant caused by your BRCA1 and BRCA2, but they will not ask you, where is it located? 17, chromosome 17, Q arm, locus 21. They will never ask that. So don't waste your time on memorizing or studying things that never come out in the exam. Okay? So how will you know? Okay, so these are the distribution of the paper 1 and paper 2 for MRCOG part 1. So you can see here, anatomy, endocrinology, and physiology occupies most of the part 1 paper. However, you cannot simply ignore biochemistry, genetics, and epidemiology and statistics. Okay, why? Because if you can see here, anatomy occupies only less than 1/4 of the pie of the paper 1. So even if you're very, very good in anatomy, you will never perfect all those exam questions in anatomy. So if there are 25 questions in anatomy, you will never get 25 questions correctly. Okay, so you understand? So that means you cannot simply ignore all the other subjects because it contributes to the passing of the exam. Okay, just like in paper 2. So you have more in data interpretation and clinical management. Remember, the data interpretation and clinical management is the summary, okay? It is the summary of all the subjects together. So you cannot interpret a data just asking about anatomy. So it's a summary of all the subjects put together. Okay? So step 4, you have to know the important high-yield questions. And when we say important high-yield questions, we are simply talking about the recalls, okay? So recalls is very, very important because there are exams, there are questions that tends to be repeated. However, sometimes they are twisted or sometimes they are rephrased, but these important high-yield questions are the things or the questions that always comes out in every exam diet. Okay, so when we say important high-yield questions, these are recalls. And recalls gives you an idea of what comes out in the exam. Okay, however, do not rely on recall keys posted on social media unless the source is reliable. You have to always verify the key. The smart way to study is not to memorize the key. Okay, the smart way to study is to justify why the key is the key. Why is it the answer? So you don't stop in memorizing the key to the recalls. Remember, guys, even if recalls are repeated several times in the exam, recalls are only 30 to 50% of the exam. Okay? So even if you correctly memorize all the recall keys, it will only make you pass 50% or maybe less than 50%. Where will you get the remaining percentage in order to pass the exam? Okay, so usually the passing percentages runs from 65 to 70%. Okay, sometimes 60, okay, sometimes 60, and there's only one time that it was very, very low percentage, which is 57%. because the exam was very, very difficult. Every student find it difficult. So the passing percentage is 57%. And that was like 3 years ago or 2 years ago. However, it is always above 60%. Okay. So where will you get, for example, the recalls are 50%. Where will you get the remaining 10% if you will not study? Right? So you don't just rely on the recalls alone. You need to make your foundation strong. Okay. For example, let me give you an example. In every exam, there's always a question about bacterial vaginosis, and they will give you a scenario about bacterial vaginosis, like fishy smell, like that. Um, and they will ask, what is the pathognomonic cells in bacterial vaginosis? So the answer, as you all know, it's a clue cell. Okay. So some of the students, they stop memorizing. Okay, pathognomonic cells in bacterial vaginosis is clue cells, and they never study around that answer. So when you encounter this type of recall question, so you have to not only memorize clue cell, but you have to know everything about clue cells, because the next exam, and this is a real scenario. The next exam, the RCOG or the Royal College they give a scenario about, and you are thinking this is bacterial vaginosis, and then the question is, the clue cells, the cells that is pathognomonic of bacterial vaginosis are clue cells. And then the question comes out, what are clue cells made of? Okay, so everyone was shocked. Everyone doesn't know what clue cells are made of. So clue cells, guys, are made up of epithelial cells that is surrounded by bacteria. So this is what I'm telling you. You don't stop on memorizing the key. You have to go around those scenario, around those recall keys, and study everything about clue cells. Another example, there's a scenario about after delivery, okay, normal spontaneous delivery, that because of the long time, the legs of the patient were in stirrups. Postpartum, there was a damage that causes foot drop. So we all know from med school that the cause of foot drop is common peroneal nerve. Okay, right? So we know that. We memorize foot drop, common peroneal nerve, foot drop, common peroneal nerve. The next exam, common peroneal nerve was not among the choices. So some students were shocked because why there's no option for common peroneal nerve? The cause of foot drop is common peroneal nerve. But if you study and if your foundation is strong, you know that common peroneal nerve is a terminal branch of your sciatic nerve. And sciatic nerve is in the choices. So the answer is, damage to this nerve causes foot drop. The answer is sciatic nerve. So those who don't know, they lose this 1 point. This is what I'm telling you, okay? So you have to go around those answers. And the last step is limit social media. Okay, limit social media, guys. You spend too much time on social media. I know. Okay, you're very, very guilty of spending too much time on TikTok, Facebook. Okay, you spend 10 minutes reading your books and you get bored easily. However, you don't know that you spent hours on social media and you don't notice that the time has already lapsed, right? When you are checking these Facebook reels, okay, so many Facebook reels, and you don't know that you have been watching your friend's story and the Facebook reels. You're already in your Facebook, in your mobile phone for almost an hour, and you don't notice it, right? So what you will do is, this is the fact, okay? When your friend posted something, oh, she posted a brand new dress or a brand new shoes, okay? The social media gives you a psychological high that makes you feel like it's a reward cycle. So you post something, you share it, and you get happy when you have a lot of likes and a lot of comments, because this triggers the reward center in your brain, right? Dr. Sohaila is laughing. Because it's true, Dr. Sohaila is spending too much time in social media, probably. Okay, so the solution is make learning as addicting as like social media. If you don't understand anatomy, you can go to YouTube and then you can open those free accounts like Khan Academy or osmosis.org, and you can understand something that you don't know. Okay, for example, uh, the Krebs cycle. If you find the Krebs cycle so difficult because this has been long time ago that you studied in biochemistry, there are a lot of videos, free videos in YouTube explaining about the Krebs cycle. And sometimes they are in cartoon form, like osmosis.org. That makes learning more easy, right? So I know you won't always be motivated. However, you must learn to be disciplined. Okay, motivation is very hard, but discipline is very, very easy. You have to control yourself. Okay, if somebody invite you to a party and it's not important, you have to prioritize studying first, right? And we have a good news for you. During my time, the regular course that we offer in MedExam Expert is only 3 months, and the progressive course is only 1 month. But now the times have changed. The students wanted to study harder. So the regular course started 6 months, it spans for 6 months, and the progressive course uh, is extended up to 3 months. Okay, and for us to, if you don't have any questions about the best strategy, I will give you back to our course manager, Fatima, to discuss to you about our progressive course. Our progressive course will solve all these problems, step 1, 2, 3, 4, 5 for you. Okay, and then if you have questions, after Fatima tell you about our progressive course, and then we will be free to answer your questions. Okay, back to you again, Fatima.
Thank you so much, Dr. Desiree. Let me just share my screen. So I hope my screen is visible now. All right, so let's get started. First of all, thank you so much once again, for this wonderful strategy. Now I'd like to take a few minutes to introduce you all to the progressive course that we have just launched, and it is going to start soon. So again, if you are planning to start your preparation for January 26 intake, we have got you covered with this course. It is one of the most comprehensive and result-oriented programs. Trust me when I say this, because later on you'll see also be sharing some reviews as well. So it is designed specifically for those students who are going to start preparing, like they are going to start preparing now or after the exam booking. So let's see what the course is offering. Number one, because the format of the course is basically it's a fast track course, so we offer bundle wise live sessions in this. Now, what is bundle wise live sessions? All the syllabus of MRCOG-1, we have divided the modules into a bundle, which is basically a group of 1 to 2 modules. So we are going to have this bundle wise sessions, and in order to support those lectures, we are going to provide you with the detailed module wise lectures as well. So you can study on your own and have the study time. And after that, we will have this session. So you will have a complete understanding of the subject and ultimately the bundle. Again, to help you and to make you more comfortable, we are also providing you with the session recordings of the bundle-wise modules and the module-wise lectures. The PDFs will also be given to you of all the live lectures. Then we have topic tests. Now, what is topic tests? Topic tests are basically right after the session. Once you are done with complete bundle, we will check your knowledge. So it is basically assessment test of where you're standing after completing a certain module. So you will also be given these topic tests, which are module wise again. So after that, we will also have mini mocks included in that, and ultimately the final mock, which is on Pearson VUE pattern. It will help you a lot in your exam preparation, and you will know that what exactly will be the format once you enter the exam. You will also have a Telegram study room, which is a dedicated group in which on daily basis we are going to share questions, practice questions. We are going to solve your queries if you have any. And exam booking assistance. As you know that we are going to have exam booking soon, so you can always take help from any of our course counselors. So apart from all of this, these features, we are going to give you some exclusive compliments, which is the exam like questions workshop, which is basically a 10 days workshop in which we are going to cover all the important exam questions right before your exam from 1st till 10th of January 26. Now, this workshop will help you a lot with the last minute confusion and revision of all the questions. And it will like give you a very good idea that what kind of questions are going to come in your exam. The second exclusive complement is the biostatistic workshop. Again, biostatistic, it's not an easy subject for all. So we have given more time to this subject, and we have kept it like a 5 days duration workshop in which we are going to cover all the topics, and then we are going to provide you with the question, high yield files, and a topic test at the end. So these are all the features for the progressive course. Now let's move ahead. This is basically the schedule which we are going to follow for this plan. Okay, as you can see, it's a very organized schedule. The course is going to start from 25th of October. We have divided all the subjects, or basically all the syllabus, into 5 bundles. Okay, as you can see, bundle 1 consists of physiology and endocrinology. Bundle 2 is anatomy and embryology, and so on. So you can see that we are going to provide you all the content right away, and you will have your first live session on 2nd of November, which will cover the bundle wise thing, and after that you will have a topic test. So in similar way, we are going to cover each and every bundle, right? And at the end, you will have your exam like question workshop. So again, with a history of 98% success rate, we are ready to welcome you in our progressive course, which is going to start from 25th of October. Let me share some valuable insights from our past students who have given us excellent feedbacks. Dr. Nalini has, right after her exam, she said that she can't stay calm without appreciating us because she has passed this exam with 82%, which is a great percentage. Then we have Dr. Samya. Again, she has praised all her way, and special mention of the 1,000 exam question workshop, as you can see, and biostatistic workshop. Dr. Ikra has also achieved 88%, which is great. So these are some valuable feedback. The purpose of sharing is just because, all the students, they look up to us, and when they join the course, they are very anxious that what kind of thing they're going to get. So it will give you a good idea. So now let's formally begin with the academic session. Dr. Desiree, over to you, please.
Okay, thank you, Fatima, for the very detailed explanation. I will just like to answer the question in the chat group by Dr. Omama. Okay, so there is a big difference between the regular course and the progressive course. As Fatima has explained to you, the regular course starts off 6 months, okay? It spans for 6 months, which started off 3 months ago, okay? And in the regular course, what we do, if Dr. Umama, you are with us in the regular course, so we start with the theory, okay, subject-wise. Every week or it spans like every week we have one subject to discuss. So we start with the live session first. For example, anatomy live session, and we have a mini schedule for the rest of the week. And the next week, we will start with biochemistry. So we start with theory, and then we have some topic tests after this mini schedule, 1 week. The progressive course is different. Okay, the progressive course, it starts off with a question. It is a question based. It's not a theory based. It is a question based course. Like we start with a question first. We start with the study mini schedule first before the live session. If you can still remember the study, Fatima, can you flash the schedule for the progressive course in your slide, please? You go back to that schedule. So the progressive course starts with study. study time first before the live session, which is opposite the regular course, okay? And when what we mean by the study time is, this study time is the time for you to study all the recordings of the regular course. So we provide it for, because sometimes the student will feel that they don't have enough time, so we provide them the recording of the regular course student. However, the only difference is, another difference is, you are not included in the Telegram group of the regular course, because you have a different Telegram group for the progressive course, together with the other students that will take the progressive course. So the study time will include this, studying the PDF, studying the live session recording of the regular course, and then we will have a live session. The live session includes two subjects. For example, here, bundle 1, it is physiology and endocrinology. So we will be discussing high-yield questions about physiology and endocrinology without the theory part. Okay, no theory part. So we will be discussing only the questions and then give you the answer and then rationalize, not extensive theory part. So if you are a part of our regular course, if you are a student of a regular course, this will also help you in revising the things that you have missed in the regular course. However, you are not forced to join the progressive course, but it will help you a lot. By experience of our previous students of the regular course, because they have too much time in studying theory, this one is exam-based. So it will help you solidify your knowledge. It will help you, this is what I'm telling, that it will help you stick, the knowledge will stick to your mind, okay? Because if you're just reading theory, and then you don't practice it, then it will be difficult. The price, Dr. Shams, the team will tell you about the price, okay? Let me just tell you more about the difference, okay? So for another difference is the regular course, the biostat workshop is included in the regular course. The biostat workshop is included also in the progressive course. However, that 1,000 exam question revision, okay, the high yield question revision, which spans for 10 days, is not included in the regular course. So the regular course student, if you feel that this is actually a more expense to you, the med exam expert will be giving you special discounted price because you are already a part of the regular course. So you will not have to pay the actual price of the progressive course because you are already our existing regular course student. But what is the advantage? Instead of having only the 10-day high yield exam question, why do you have to pay for this 1,000 exam question when it is already included in the progressive course? So if I'm a regular student, I would rather take the regular course and progressive course because the exam-like question, 10 days revision workshop of the recall question is already included in the progressive course, right? So for the progressive course, as what Fatima has mentioned, it includes the recordings of the regular course, the biostat workshop, and the 10 days revision workshop from the high yield question from 2015 until 2025. Okay, but remember, guys, this PDF of the recalls, the high yield question is already also provided to you whether you are a member of the regular course or whether you are a member of the progressive course. The PDF is there, okay? It is provided to you. Okay, Dr. Amama? Okay, so if you want to ask about the prices, the team will contact the team privately and they will give you the exact price. Okay, and yes, you can only join the workshop if you want. Okay, so there's another gift for you guys. Those who attended this webinar will have a special discount if you join our progressive course. So you just have to ask your the team. Okay, Dr. Romaisa Ibrahim, your video is open. Can you please close your video, Dr. Romisa Ibrahim? Okay, you're already registered. Where? Wait. Who's this? Dr. Muhammad, you already registered, so no gift for you? You already contact the registered where for the progressive course? Dr. Muhammad? Oh, you can ask the team if you're still entitled for the for the special discount. Okay, so let me just share my screen. It's okay. Good. Thank you very much, Dr. Muhammad and Dr. Shima, for registering in the progressive course. I think if you're a member of our regular course, I think you already got a special discount being a member of the regular course, right? Where is my screen? Okay. Okay. So one of the most difficult topics in the scam in the exam is biostatistics, right? So Dr. Desiree is always assigned with the difficult topics like microbiology, genetics, and yes, Dr. Muhammad, don't worry. Okay, I'll make biostat and epidemiology very, very easy for you. So let us now go to the topic for today, mastering epidemiology. So what epidemiology is also a vast subject. What in basically in epidemiology that you need to know in order to pass the MRCOG-1 exam. Okay, so what is essential for you to pass? Okay. So let's define first epidemiology. Epidemiology is the study of frequency, distribution, and determinants of diseases and other health-related conditions in human populations, and the application of this study to the promotion of health and the prevention and control of health problems. So this is what epidemiology is all about. Okay, so let's dissect it one by one. So what are the major components of the definition? So you can see population. So epidemiology is more concerned about the population. The main focus of epidemiology is on the effect of the disease on the population rather than individual. So what does this mean? So between a person, an individual with lung cancer and and malaria in sub-Saharan Africa, epidemiology will be most interested in the malaria cases in a particular location rather than a person with lung cancer. Okay, because a person with lung cancer, you know that lung cancer is a terminal illness and this person will eventually die. So epidemiology is not concerned about that. Epidemiology is more concerned about how malaria will affect a particular population. Okay. Next, frequency. So the epidemiology is concerned with frequency or occurrence of disease and other health-related condition. And this frequency of diseases is measured by morbidity and mortality rates. Okay, so when you say morbidity and mortality rates, this is what comes out in the exam, and I will tell you all those definitions later on. And when you say health-related conditions, these are conditions which directly or indirectly affects or influence health. When you say directly or indirectly, these are existing medical conditions, or when you say indirectly, this is like the socioeconomic status of an individual and the access to medication, which influence the health of that particular individual. When you say distribution, this refers to the geographical distribution of diseases. For example, you cannot see yellow fever in America, right? You cannot see dengue fever in the UK. So distribution it refers to a particular geographical distribution of diseases, the distribution in time, and the distribution type of the persons affected. And when you say determinants, these are factors which determines whether or not a person will get the disease. Okay, so there are 4 stages of the disease, and this is very, very important in epidemiological study. Why? Because this is where they target the treatment or the prevention of the disease. So the 4 stages are stage of susceptibility. So when you say stage of susceptibility, the disease has not yet developed, but the groundwork has been laid for the presence of factors that are that is favoring its occurrence. For example, a child who is unvaccinated will be susceptible to measles. Okay? Second stage is the stage of pre-symptomatic or subclinical disease. There are no manifestations of the disease yet, but there are already pathological changes that have started to occur in the body. So one example of this is a person applying for a job, okay, and a person who wants to get a person applying for a job, for example, so they will ask for your stool exam, right? So the person is healthy, but the stool exam turns out to have ova or parasites. So this is what you call pre-symptomatic. The patient doesn't have diarrhea, the patient doesn't have abdominal pain, the patient is perfectly normal. However, there are already changes that happens in the body of that individual that doesn't present with symptom. And another example is when you apply for a job, you will get tested for HIV, right? So for HIV, for this person who is simply looking healthy and the result turns out to be positive, so that means the patient is already harboring the disease. However, there are no clinical manifestation yet. So we call this a stage of pre-symptomatic subclinical disease. The third stage is your clinical stage. This is where the person develops signs and symptoms of the disease. And diseases has different clinical stages, and it differs in duration, severity, and outcome. So let us take, for example, three diseases. Your common colds, okay? Your common colds is a very mild, okay, a mild form of disease, and usually it resolves spontaneously without treatment. Second example is your polio. Okay, polio. So your polio ends up, if a person gets polio, sometimes the person gets paralyzed for the rest of his life. Okay, if he doesn't get vaccinated. And the third example is your rabies. Okay, the rabies is very, very fast. Okay, fast duration of the clinical stage, and most of the time, the patient ends up dying. Okay, so these are the clinical stages of different diseases. So the fourth stage is your stage of disability or death. Okay, disease may result in residual effect, leaving a person disabled for longer duration, and still other diseases will end in death. For example, meningitis. Okay, meningitis, if it is very, very severe, the patient will die. If it is less severe or moderately severe, the patient can be disabled for the rest or comatose for the rest of his life. Okay, so these are the 4 stages of the diseases. And knowing the 4 stages of the diseases, we have levels of disease prevention depending on the stage of the disease. So we have primary, secondary, and tertiary prevention. So when you say primary prevention, this targets the stage of susceptibility. So primary prevention keeps the disease from becoming established by eliminating causes of the disease or by increasing resistance of the patient to the disease. So it has 3 components: health promotion, prevention of exposure, and prevention of disease. So this is where the vaccination comes in. So that the vaccination prevents the susceptibility of the individual to developing the disease. So we call this as primary prevention. So we have secondary prevention. When you say secondary prevention, the objective of the secondary prevention is to stop or slow the progression of the disease and to prevent or limit permanent damage, okay? So that means the individual already have the disease. For example, the patient has HIV, you give secondary prevention medication so that it will not progress into full-blown AIDS, okay? And the tertiary prevention is targeted towards people with permanent damage or disability. So sometimes tertiary prevention is needed in some diseases because primary and secondary preventions have already failed. And in others because the primary and secondary preventions are not effective. So the tertiary prevention has two objectives. First, treatment to prevent further disability or death. And second, to limit the physical and psychological, social, and financial impact of the disability. Okay, this can be done through rehabilitation. So that means if the person is paralyzed throughout the rest of his life, so why not make the life more easier? Okay, like giving him rehabilitation for the existing condition, so that retaining the remaining functions for maximal effectiveness. That means he can still have quality of life even if he is disabled. Okay, so now this is very, very important for you for the MRCOG Part 1 exam, the measures of morbidity and mortality. And I want 100% of your attention. Okay, for all the rates that I will discuss in the succeeding slides, you have to take note of the numerator, the denominator, and the multiplier. So they all have these things, okay? So they only change between the numerator, the denominator, and the multiplier. Okay, so let's take for an example, prevalence rate and incidence rate. If you can see the definition of your prevalence rate and incidence rate, they differ only in the numerator. So for prevalence rate, persons with existing disease at a given place and time divided by the population at risk of the disease at the same place and time. For incidence rate, you have to change the numerator to new onset disease, okay? This is how you memorize, okay? Persons with new onset disease at a given place and time divided by the population at risk of the disease at the same place and time. Hello, please turn off your microphones. Dr. Ananta, your microphone is open. Ananta, close your microphone, please. Okay, thank you. Okay, so let's take for another example, birth rate and fertility rate, okay? So birth rate, the rate of live births in a population, follow my pointer, during a time period, times multiplier of 1,000, the same. You can see here, let me change my, let me just change my pointer, okay? So you can see more. Okay, you can see here, rate of live births in a population, also rate of live births, but this one is changed among women of childbearing age, but the multiplier is also the same, okay? So they change only in the denominator. This is what I'm telling you. Numerator, denominator, multiplier, numerator, denominator, multiplier. So this makes it easier for you to memorize, okay? So what about mortality rate or the crude death rate versus case fatality rate? The same, okay? Rate of deaths in the population and rate of deaths due to specific illness. This is the difference. They also differ in the multiplier. This is 1,000 and this is 100. And they also differ in the denominator. Okay, so that's overpopulation times 1,000 is your mortality rate, and that's due to specific illness per number of cases to that illness times 100 is your case fatality rate. Okay, so we also have another definition. Okay, you can see here, cause-specific mortality rate versus proportionate mortality rate. I'm sorry, guys, but all of this rate you have to memorize, okay, for the exam. Specifically your perinatal mortality rate and your maternal mortality rate, which we will discuss later on. Okay, so for cause-specific mortality rate, this is the same case rate that's due to specific illness divided by the total number of population, and here divided by the number of total deaths, the same multiplier. Okay, so let us put it side by side. So this is your case fatality rate, this is your cause-specific mortality rate, and this is your proportionate mortality rate. You can see the same numerator, the same multiplier, okay, but it differs on the denominator. So that's the only difference for these three mortality rates, okay? So you have to memorize this. Okay, now let's go to infant mortality rate and stillbirth rate. Infant mortality rate is the children, death of children less than 1 year of age divided by live births times 1,000. Okay, this is the definition of your infant mortality rate. So stillbirth rate is the number of stillbirths per 1,000 total births. When you say total births, it includes live births and stillbirths. So you have to remember the definition of stillbirth because this comes out in the exam. So how do you define stillbirth? Okay, so for let's go in this slide first. For the WHO, the stillbirth is defined as death from 22 weeks, okay, age of gestation. This is for your WHO. And for the UK, this is deaths from 24 weeks, age of gestation. So that's the difference, okay? So when you compute for the perinatal mortality rate, okay, it's the number of stillbirths. So depends whether it is WHO or the UK. Okay? And death in the first week of life, this is what you call your early neonatal death because it's in the first week of life, okay? Per 1,000 total births. Okay? So when you say total births, as I've mentioned, this includes the live births and the stillbirth. Okay? So you have to be very careful in analyzing your scenario. If the scenario is asking according to WHO or according to the UK, so you have to choose 22 and 24 accordingly. Okay? Also, for maternal mortality, there's a difference between the WHO and the Membrace UK. Okay? So for the WHO, maternal mortality is defined as the number of direct and indirect maternal deaths during pregnancy within 42 days at the end of pregnancy, okay, per 1,000 live births. So this is the difference. 42 days per 1,000 live maternities or pregnancies. Okay, so the definition is the same, but the denominator is different. Okay, so this is the definition of maternal deaths according to WHO. Okay, so guys, I need you to focus your attention on the definition. We have here maternal death, we have direct maternal death, we have indirect maternal death, we have late maternal death, and we have coincidental death. Okay, guys, please take note. There is no early maternal death because some students, because there is a late maternal death, they think that there is early maternal death. There is no early maternal death, guys. So when you encounter early maternal death in the options, please eliminate that immediately. Okay, there is no early maternal death. So we only have maternal death. That means death of a woman while pregnant or within 42 days of the end of pregnancy from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. So be very, very careful of the definition. At the end of pregnancy, and when you say end of pregnancy, this doesn't only include birth, okay? This includes birth, ectopic pregnancy, miscarriage, or termination of pregnancy. So that means if the patient died 42 days within termination of pregnancy or 42 days within miscarriage or 42 days within after ectopic pregnancy, it is still considered as maternal death. Okay? So remember, pregnancy, not only delivery. Okay? Second, direct. This is direct causes resulting from obstetric complications of the pregnant state. And when you say indirect, okay, causes other than pregnancy or pre-existing disease like COVID-19, like cardiac diseases, like what else? Other causes, epilepsy, okay? Pre-existing diseases that is aggravated by pregnancy, but not directly related to pregnancy. When you say direct, these are uh, death due to pregnancy and labor. Thromboembolism during pregnancy is a direct cause, okay? And guys, remember, suicide. Suicide is not indirect, okay? Suicide is a direct cause of death. Okay? Coincidental. Coincidental. A pregnant woman suddenly, while withdrawing money from the ATM machine, some people come to her and then say, this is a hold up. So, and then suddenly kills that pregnant woman. So this is coincidental. That means it is not related to direct cause or indirect cause. So this is coincidental death, okay? Road traffic accident, for example, vehicular accident. This is a coincidental death, okay? So there was statistically significant increase in overall maternal death in the UK from, okay, let me explain that using infograph. Okay, so you can see here, this is the Embrace UK report of 2023 and 2024. Okay, usually they are often questions coming from the Embrace report. Okay, so let me ask you a question. So a scenario, I'll give you a scenario and tell me. Okay, according to Embrace report of 2020, okay, the most common leading cause of indirect maternal death is, give me an answer. Is it COVID-19 or is it cardiac diseases? Answer in the chat box. According to Embrace report of 2020, the most common cause of indirect maternal death is A, COVID-19, or B, cardiac diseases. I need answers in the chat box before I give you the answer. Embrace report of 2020, is it COVID-19 or is it cardiac diseases? Okay, see? Now I get you. Yes, Dr. Garima. Dr. Garima is the only one who got the correct answer. Okay, close your microphone and I will explain, guys. So this is usually a tricky question, okay? So the exam scenario says, according to Embrace of 2020, the most common cause of indirect causes is COVID-19 or cardiac disease, and so on and so forth. So a lot of the students like you, they answered COVID-19, okay? So why? Because you correlate 2020 with COVID-19, and you fail to analyze that the report of Embrace comes year after. So you can see it here. Surveillance report of 2023, it covers 2019 to 2021, right? Surveillance report of 2024, it covers 2020 to 2022, right? So the Embrace report of 2020 doesn't cover the year 2020, okay? The Embrace report of 2020 covers 2016 to 2018, wherein there is no COVID yet, right? You correlate 2020 with COVID-19. Yes, you are correct. But the Embrace report of 2020 is not from the year of 2020. It covers 2016 to 2018. And the most common cause is cardiac diseases. See? You can never see COVID-19 here. So this is what a tricky question is, right? So they trick you because, you know, 2020 COVID, Embrace report 2020, that's the time of the COVID pandemic. So the most common cause will be COVID. No, you are wrong, okay? So this is the Embrace report of 2020. So it covers 2016 to 2018. The most common indirect cause is cardiac diseases, and the most common direct cause is your VTE or your blood clots. Okay, so let's go back to the report of 2023. So you can see here, Embrace report of 2023, it covers from 2019 to 2021. So naturally, COVID-19 is already there, right? And Embrace report of 2024, it covers 2020 to 2022. Naturally, COVID-19 is there. Okay, so when they ask you about the overall cost of maternal death, according to Embrace report of 2023, so overall, which is the highest, you have here three. So you have your COVID-19, you have your cardiac diseases, and you have your VTE as the overall cost. If they ask you about the direct cost, it's your VTE, and indirect cost is your COVID-19 and cardiac disease equally. Okay, so this is how you analyze your infographics, okay? So for 2024, the overall cost of maternal death is your blood clots, indirect cost is your COVID-19, not equal, okay? And direct cost is your blood clots, VTE. The cardiac disease is only second, okay? So now let's go to 2020 because this is the question that they always ask, okay? So overall is cardiac diseases, okay? Direct cause is your VTE, and your indirect cause is your cardiac disease. There's no COVID-19 because this is 2016 to 2018. Now let's go to the recent, okay, report in 2025, which covers, you see, 2021 to 2023. Okay, so always remember that the report, the Embrace report, comes years after. So this is the leading cause of maternal deaths. So you can see the overall is your blood clots. Okay, if they ask you the most common cause overall, VTE, direct cause is your blood clots, and your indirect cause is your heart disease. Okay, third is only the COVID-19. Okay, so let me tell you guys, aside from these reports, okay, the previous years, okay, before the Embrace report of 2023, the most common direct cause is your thrombosis or thromboembolism or your blood clot. Okay, and the indirect cause is always cardiac diseases. It only changed in the Embrace report of 2024. In 2024 report, the most common is your VTE. The most common indirect cause is your COVID-19, followed by your cardiac diseases. Okay, so this is the only change here. It's always thromboembolism, cardiac diseases, and now in 2025, it goes back to this. Okay, the same. Okay, it's thromboembolism and cardiac diseases. So you don't have to memorize all the Embrace, okay, because the Embrace from way back 2015, 2016, 2017, it's always like this. It only changes on the infographics that I showed you. Okay, so in 2023, the COVID-19 tied with cardiac diseases for the indirect cause, and the direct cause is the VTE. Okay, and in 2024, you have to memorize this. The COVID-19 surpasses the cardiac diseases. Okay, so maybe they will ask you, according to Embrace report of 2024, what is the most common indirect cause? So you don't answer cardiac, you answer COVID-19, because this is the only report that COVID-19 surpasses cardiac diseases. You have to you have to memorize this 2024 report, 2023, 24, 2020, and 2025. Okay? So this is how we do our regular course. We give the theory and then we ask questions after. So I have here some set of questions, and I'd like you to write in the chat box the answers to these questions. Okay? I'm waiting, in the chat box. The WHO defines perinatal mortality, I told you, as Dr. Garima says B, Dr. Uba says B. Dr. AE says B. Muhammad says B. Sohaila says B. Very good, guys. Okay. So when you encounter this question, immediately eliminate 24 because this is WHO and you know that 24 is for the UK, right? So eliminate. And this one is not very specific, so eliminate. So you're only left with B and D. Okay? So that's why I told you have to memorize the multiplier. Okay? So the correct answer here is B. Very good, guys. Okay, next question. The World Health Organization defined maternal mortality ratio as World Health, WHO. So you know that WHO talks about what? Is it live births or live maternities? And the UK talks about what? D. Dr. Suhaila says D. Who else? AE says D. Shima says D. Uba says D. Okay, very good, guys. So it's D, huh? Very good. So that means you're listening to my session. Okay, so it's D. So it's maternal death. So the exam will come out like this, very, very close to each other. So you have to memorize. So it's not 10,000. So you eliminate that and it's not 1,000. So it's always 100,000. And when it's WHO, it's live birth. And when it is UK, it's live pregnancy or live maternities. Okay? So WHO defined maternal death, okay, maternal death as be careful, read carefully the options. Dr. Suhaila says D, Dr. Ann says D, Dr. Shima says B, Dr. Zahar says B, Dr. Uba says B, Lala says D, Umama says E. Guys, the magic word, okay, stop writing. The magic number for maternal death is 42, okay? But it's 42 days, guys. 42 days. Dr. Garima says, very good. Okay, so don't haphazardly answer the question, okay? Read, because you get 42. Remember, this is hours. So eliminate, when during the exam, eliminate the hours, okay? So 42 days is equal to 6 weeks, guys. Dr. Shima. Dr. Shima, you answered 42 haphazardly. So the answer here is D. So death of a woman during pregnancy or within 42 days or 6 weeks of termination of pregnancy. Okay? So this is an actual exam question. Okay? They trick you because your mind is already in 42. Okay? So you have to know it's 42 days, guys, 42 days. And late maternal death is 42 days up to 1 year, okay? Next question. The eighth confidential inquiry to maternal deaths in the United Kingdom, so this is the UK, defines maternal mortality as, this is not WHO. Dr. Suhaila says C, Dr. Garima says E, Dr. Ann says E, Dr. Suhaila, it's E, okay? So it's not per 1,000 mortalities. It's, remember I told you, if WHO, it's 1,000 live births, and in UK, it's 1,000 pregnancies or maternities, okay? So the correct answer is E. Dr. Vivo, it's not C. There's no definition about mortalities. Live births and pregnancy. Remember, it's maternal deaths, it's live births or maternities. Okay? So this is how this is how we conduct regular courses, theory and then question. And this is an example of how we conduct progressive course. So I'll just give you a feel of it, okay? During the progressive course live session, we talk in bundles. So we start with a question, okay? And then we give the answer, and then we give the explanation why it is the answer. So the most common gynecological cancer in the UK is, answer in the chat box. Some says, Dr. Uba says breast cancer. Muhammad and Sadia says cervical cancer. Dr. Garima says breast cancer. Dr. Ann says endometrial cancer. So only Dr. Ann got the correct answer. Dr. Lala also. Okay, so it's endometrial cancer, guys. It's not ovarian, Dr. Sama. Okay, so this is how we do the progressive course. So to clear your misconception, the most common female cancer, okay, the most common female cancer is your breast cancer. But it is specifically asking about gynecological cancer. Okay, so you should eliminate breast cancer and choose among these three. Okay, so why is it not cervical cancer? By reasoning, we screen cervical cancer. Okay, so we screen cervical cancer using pap smear or your liquid-based cytology. So that means you can catch cervical cancer at the stage of susceptibility before even the disease progress, right? And then you give them cervical cancer vaccine. So that means it is not the most common gynecological cancer in the UK, okay? Because it is properly screened. So the answer is endometrial cancer, just like Dr. Lala and Dr. Ann says, okay? So let me explain. So this is the gynecological cancer incidence according to the cancer statistics in the UK. So the most common here is uterine or your endometrial cancer. The second is your ovarian cancer. The third is your cervical cancer. And you can see also here in the UK of 2014, this is the female cancer incidence, not gynecological. So Dr. Garima is correct. If the question is the most common female cancer, the answer would be breast cancer. Okay, followed by your lung cancer and the bowel cancer. Okay, but if they ask you about gynecological, put aside your breast cancer. I know Dr. Garima is thinking about breast cancer month because today is this month is October. So Dr. Garima is fixated with breast cancer. Okay, Dr. Garima, it's clear now. If they ask about the most common cancer in female, the answer is breast cancer. But if they ask the most common gynecological cancer, don't give me cervical cancer. Okay, it's uterine or endometrial cancer. Okay, so in a town with a total of number of live births 300, the maternal death is 900, the stillbirth is 300. What is the maternal mortality ratio? Okay, maternal mortality ratio is the definition by the WHO. It is the death during pregnancy and within 42 days, maternal death over the total 100 total live births times 100,000, right? And when you say live births, this include stillbirth and live birth. Okay? So what is the answer here? Can you do fast computation using your calculators? Calculators, by the way, is now allowed in the exam. So give me an answer. Faster, faster, guys. Dr. Sham says A. Okay, so the correct answer is A. Dr. Shams, you are correct. Okay, this is the computation. Maternal death over the total births times 100,000. So this is, I think this is correct. Okay, but this is incorrect. This is the correct one. Maternal death over live births times 100,000. So it's 900 maternal death plus 300,000. Okay, plus the stillbirth. I think this computation is wrong, right? So it should be 900 divided by the live births. When you say total births. Sorry, not live births. This is total births. Let me go back so that let me go back to the definition so that I will not give you false definition. So this is 42 at the end of pregnancy per 100,000 live births. Oh, sorry, it's only 100,000 live births, not total births. Okay. So my first formula is correct. So it's live birth per 100,000. Sorry, I got confused with the stillbirth. So it's only the stillbirth that includes the total birth. Okay, it's included in the total birth. So this is live birth. So it is just like computing for 900 divided by 300,000 times 100,000. So it will give you, Dr. Shams is correct, it will give you 300. Okay, so the answer is A. So it's 900 divided by 3,000 times 100,000. So just correct this formula. Okay, this is wrong. Okay, so incidence of rare disease when translated into mathematics is, can you give me a guess? Yes, it's correct, Dr. DA. Dr. Ann. C. Dr. Suhaila says C. Yes. Okay. Dr. Uba says C. Dr. Ann says E. Wrong, Dr. Ann. Dr. Lala, Dr. Uba, correct C. Okay, so it's C. So remember, when you are talking about the incidence of diseases, it is only until 10,000. Okay, so eliminate D and E immediately. So you have to choose among these. The answer here is C, correct. Okay, so why? This is a portion in the RCOG Clinical Governance Advice presenting information risk. It is an RCOG official document. So this is how you tell a patient about the risk of developing a certain disease. So in counseling, when you say it's rare, so it is 1 to 1,000 to 1 into 10,000. If the patient cannot understand it, you can tell that it's like having one person in a small town. Okay? So you have to memorize this. It's only until 10,000. So when you encounter this question, eliminate 100,000 immediately. Okay? So I think that's it. Do you have any questions regarding epidemiology? For epidemiology, this is only a portion of your biostatistics, okay? So this is only a small portion of the biostat. This is the epidemiological terms and the maternal and mortality rates. So the whole of biochemistry will be discussed in a week's session, in one whole week session. Okay, do you have any questions, guys? The difference, Dr. Sohaila, of maternal mortality ratio and maternal mortality rate is the same, except WHO call it a ratio and the UK call it maternal mortality rate. And they differ only in the denominator. For maternal mortality ratio, it's live births, and maternal mortality rate, it's pregnancies. Okay? Thank you, Dr. Sadaya. Okay, guys, if you don't have any questions, please, I hope that you will join us in the progressive course. Also, our regular course student, I hope you will also join us in the progressive course. So if you want to ask about, you're welcome, Dr. Shima. If you want to ask about the prices, you have to ask our back-end team. Thank you, Dr. Sahaila. You're welcome. Okay. Happy weekend, guys. Thank you. Bye-bye.